Hello, everyone. I'm Carlos Dora. I'm the incoming president of the International Society of Urban Health. And on behalf of ISUH and ISUH leadership and our members, I'd like to extend our very warm welcome to all of you who have opted to join us for 3 days of dynamic global conversations, exchanging latest evidence, experiences, and innovation in urban health, happening in real time and across all corners of the world. We're very proud to be hosting this year's conference in partnership with the Pan American Health Organization, the regional office for WHO for the Americas, and with SALURBAL, the Urban Health Network for Latin America and the Caribbean, which engages members from 13 countries in the region, plus other members in the UN. We are delighted to have today also top-level leadership of WHO and of UN Habitat represented and speaking to us in a minute or two. I would like to start with some thank yous. And the first one goes to our sponsors of the conference, the Botna Foundation, Novo Nordics, and the Novartis Foundations have been very generous and allowed us to complete the conference and to carry on. The scientific committee, which is large and includes a number of partners of ISUH, but also the ISUH board members, who have been very engaged in this trajectory and have played a special role in the conference. A big thank you, ISUH being a network. Our partners are really important and really part of our DNA and who we are. So I would like to thank a number of partners. And for the conference organization, I'd like to thank specifically 4 people who have been, carrying a lot of the piano. These are Anna Diaz-Roux and Catherine Indvik from SALURBAL, and Joe Avi-Burford and Gina Gonzalez from ISUH. A warm thank you for all of them. A few statistics from the conference. I mean, it's in spite of lockdowns and difficulties, there's enormous amount of information, which is of very high quality. We have over 400 delegates, 300 abstracts and posters, oral presentations, panels, 21 panels, 7 pre-conference workshops, and a number of scholarships having been given as well. So I'd like just to remind us all what ISUH stands for. And because ISUH is the only global non-governmental organization which is solely focused on advancing urban health and health equity by addressing the broader determinants of health. This is our board of directors, which help us take the work forward. And this is our 17th conference. So it is not every year, but we know it's been steady, and it's been, they happen in all parts of the world, and they have been fundamental to ISUH to develop its partnership and its focus and its support to countries. Finally, I want to share with you some very good news, and I'm pleased to share those good news. The first is the large project that Foundation Botna that the ISUH is implementing by Botna Foundation with adolescents healthy cities for adolescents in Colombia, Senegal, and Ghana are continuing, and we have expanded to Vietnam and various cities in Vietnam and India. The second big news is very big because it's to welcome our new executive director, Giselle Sebag. Giselle Sebag is an asset to the organization. We're really privileged to have her working with us, and she already started. She's training in sustainable architecture, and she's an urban planner. She has postgraduate training in public health at Harvard, in IS Global in Barcelona. She has a vast network of urban health and collaborated and worked in parts of Europe, South America, North America. And I'm really pleased to have her and very happy to have her. We are very lucky, and I want you to join me in welcoming her as our new executive director. The final good news, which again is very good news, is a collaboration that we recently developed with the World Health Organization, which is to map research and action in urban health across the globe. In doing that, we're engaging very senior members of ISUH in 6 continents, and we're operating in 8 languages. Now, this is major because we're able to tap and to make the best of ISUH strengths, which is our regional and local presence, and to bring these different perspectives together and to partner with WHO, which has been really a privilege. I'll finish by saying, and this is just a representation where we are today, who we are is this big. The field of urban health is very vast. It has many players. And ISUH, I think, is one of these elements that helps connect and bring together these various players. It's especially important at this moment in time when COVID has been devastating and is still ongoing and has emphasized the crucial role of health in enabling urban development, but also the tight links that health has with local determinants. Overcrowding is today the most dreaded risk factor, and clean and open spaces, or clean air and open spaces, are key to the solution. Never before has local conditions determining where people live, work, play, have been so central to the public debate and to government's policymaking and decisions. Our scholarship of the network and on-the-ground experience of the practitioners are essential ingredients to create better policies and strategic program insights about working with city stakeholders to build better, not only the economy, but also to address the inequities and the root causes of disease, including of the pandemic, has made so apparent. As a global network that facilitates connections across sectors, across agendas, across disciplines, I think ISUH is poised to continue to work with all of you to advance our vision of health, health equity, and sustainability for cities and for citizens in all cities of the world. And we are strategically reflecting on how best we can use these trends as we put together our next strategy, which I can say immediately is all about engaging and supporting people who are in small cities as well as in big ones and in all countries of the world. So I thank you for the opportunity to be with you and for you being with us and all the participants who have joined us in this exciting endeavor. We don't know yet where we're going to be next year. We're still looking for the place, but we know what we're about and we know our focus. So with that, I would like to thank you all. And I have an enormous pleasure to introduce Dr. Carissa Etienne, whom I know for a long time and who's the director of the Pan American Health Organization, the regional director for the Americas of the World Health Organization. I'll say a few words about Dr. Etienne. She has an extensive and impressive career in public health. Before she's now serving her second term in the Pan American Health Organization since early 2018, where she was elected by Pan American, Caribbean, and South American and Central American member states. Before that, she worked for the World Health Organization in Geneva as an assistant director general. And previously, she was coming from PAHO, and where she worked with health systems, technology, healthcare and research, health surveillance and disease management, family and community health, and sustainable development, environmental health. So she's done it all. And I think that explains why urban and cities are so important in her programmatic area. In Geneva, I'd like to stress that she's led the development of the Health Systems Financing World Health Report in 2010, which was a landmark in setting the way for where countries what they could do to finance universal health coverage. She's been very instrumental in supporting universal health access to safe and efficacious medicinal products. She's also set the code of practice for international recruitment of health personnel, and she chaired the International Health Partnership that helps different development partners to bring their focus in health in a coherent manner. She's a native of Dominica. She's a medical officer, first at the Princess Margaret Hospital, then was appointed chief medical officer in the country. And she worked in a variety of areas: primary health care, services, national AIDS program, disaster coordination for the Ministry of Health. And she has her medical degrees from the University of West Indies in Jamaica, a master's in community health in developing countries from the London School of Hygiene in Tropical Medicine, where I also completed my training. So I'm very pleased to have to pass the microphone to Dr. Carissa Etienne. Thank you for being with us.
Thank you, Carlos. I told you to go easy on me. But a very good morning to you all. And let me say buenos dias, bom dia, y bonjour. So let me greet distinguished mayors and city representatives, the organizers of this conference, including ISUH and SALURBAL, panelists and esteemed colleagues, ladies and gentlemen. Let me say that I am pleased to be here at the 17th International Conference on Urban Health under the theme, Transforming Our Collective Urban Future, Learning from COVID-19. As you well know, COVID-19 is having dire consequences in the region of the Americas, causing immeasurable human suffering and death, devastating economies, destabilizing our societies, and putting our cities under unprecedented strain. The human cost of this pandemic, along with its economic and social impacts, will be felt for years to come. And in this context, our cities will be vital to our response and recovery, and indeed, our collective future. Latin America is amongst the most urbanized regions of the world. Over 80% of the region's population lives in urban areas, and more than 90 million people live in megacities of more than 10 million inhabitants. No wonder our great interest in urban health and urban development. The consequences of unplanned, uncontrolled urbanization have widened the social gap within cities due to a lack of employment opportunities, social determinants of health like housing, and social and environmental protection. Latin America is also one of the world's most unequal regions, being home to the 19 of the world's 30 most unequal cities. The region suffers from the high levels of violence, as well as other challenges such as overcrowding, very high road traffic levels, and air pollution. Its health landscape is also changing rapidly with a steady increase in non-communicable diseases. At the same time, the COVID-19 pandemic has not only exposed existing inequities in the region, but also exacerbated them. It has made more evident than ever that vulnerability extends beyond individual and biological characteristics and is determined by the social, economic, and political context. Informal workers, migrants, and people living in overcrowded conditions, among others, have proven to be especially vulnerable in the face of COVID-19. In this context, cities and municipalities are vital to lift some of this burden from the most marginalized communities. Cities have been at the front line of the COVID crisis. The pandemic has shown that sustainable and resilient cities are more prepared to deal with major health and other challenges. It has also laid bare the variety of problems that cities face and will continue to face. I think that we are now at a turning point when we must build a collective, inclusive, and equitable response to the pandemic and to the inequities that it has exposed and intensified. It is undeniable that the role of local governments, actors, and communities is now more crucial than ever. We must give them the resources and the space that they need, and we must respect and facilitate the local government's agenda. In this sense, it is important to note that Latin America has one of the longest and most established trajectories of work with healthy cities and municipalities. It has also long been a hub for innovative policies and interventions in urban health and well-being. And I hope that our participants from Latin America will share generously of their experiences. A regional network of health municipalities, cities, and communities was facilitated by PAHO as far as the 1980s, recognizing early on the relevance of local settings as essential for promoting health and well-being for all citizens, including the full development of people in their family, education, work, and community environments. In the last year, PAHO has been leading the effort to continue and strengthen this movement. A healthy city or municipality requires political conviction and support, as well as the participation and action from communities. It integrates actions from the areas of public health, health promotion, and community development, working across and with all sectors. So we have seen in the past examples of what political commitment at the local level can do. For example, when a group of mayors from the Americas traveled to Shanghai in 2016 to participate in the 9th Conference of Health Promotion, and there they signed the Shanghai Consensus on Health Cities, and as a result of which, the role of cities and municipalities in ensuring health and well-being was consolidated into the health promotion strategy. There are several examples in our region of cities and municipalities, large and small, that have successfully applied the principles of health in all policies at the local level. In Colombia, for example, there is PAIPA, where the city council has consistently applied intersectoral actions to improve health and well-being. But we also have good examples such as Cienfuegos in Cuba and Medellin in Colombia. In 2011, the ministers of health of the regions of the Americas adopted a strategy and plan of action on urban health during the PAHO Directing Council. And this strategy was launched at the 10th International Conference of Urban Health that took place in Belo Horizonte, Brazil. This was a pioneer action in guiding the implementation of multi-sectoral activities to face the main issues in urban health in the region. And this strategy comes to an end this year when this conference was due to take place again in Latin America, in Peru. So it is important to note that PAHO's commitment to urban health and the municipal and urban agenda remains strong, and is perhaps best shown in the leading role that PAHO is playing within the WHO's global initiative on urban governance for health and well-being. This initiative is taking place in 5 cities worldwide, and 2 of those cities are in our region, Mexico City and Bogota. So this project in the Americas is putting a special emphasis on community solidarity and participation with intersectoral action, and it is considered key for building back better after the pandemic. So given the challenges that we've already outlined, it is essential that cities develop their adaptation and transformation capacities to allow for an approach that promotes health and well-being, and all of which requires good urban governance. We've also been working with other organizations like FLACMA, for instance, also UCLG, UN Habitat, and with networks such as Bloomberg Cities Network, and of course with our partners in the organization of this conference. As I said at the beginning, the COVID-19 pandemic has shown that we need now more than ever to rethink urban health and transform our urban environments. Putting the focus on inequities in cities, understanding the impact of climate change on urban health, analyzing how good governance can promote urban health and well-being. All of this is key for ours and future generations. Initiatives such as this conference, bringing together researchers, policymakers, business leaders, practitioners, and grassroots community advocates are really crucial to learning from this pandemic and from each other and building together a better and more equitable future for all. So my sincere congratulations to all of you for being here. And I wish you very fruitful discussions and exchanges as I look forward also to your final report. Over, and thank you, Carlos.
Thank you. Thank you very much, Carissa. Very pleased to have you. It's an honor to have you here with us. We'll now hear from Dr. Maimunah Sharif, who's the Undersecretary General of the UN and Executive Director of UN Habitat in Nairobi, Kenya. Ms. Maimunah Sharif has been appointed as the Undersecretary General following the election by the General Assembly in 2017. As Executive Director of the UN Habitat, Ms. Sharif has focused on reforming and rejuvenating the agency, mobilizing for internal and external support for the organization's restructuring and new strategic plan, 2020-2023. The key initiatives taken by Ms. Sharif as the Executive Director of UN Habitat include the adoption of a General Assembly resolution that after 14 years of negotiation, that established a new governance structure with universal membership and governance for the UN Habitat by the UN Habitat Assembly. Prior to this appointment, Ms. Sharif was the mayor of the City Council of Penang Island in Malaysia. In 2011, she was the first woman to be appointed president to the Municipal Council of Sebag. And as a mayor of a local authority, she led the Municipal Council of Sebag to achieve its vision of cleaner, greener, safer, and healthier place for work, live, invest, and play. Ms. Sharif began her career as a town planner at the Municipal Council of Penang Island in 1985. And in 2003, she was promoted to Director of Planning and Development, a position that she held until 2009. She was born in Kuala Pilah in Malaysia and holds a Bachelor of Science in Town Planning Studies from the University of Wales, Institute of Science and Technology, and a Master of Science in Planning Studies from the Malaysia Science University. I thank you for you all and for her to speaking in a video from Kenya, Nairobi, Kenya. Thank you. I think we have a few minutes while the video seems to be opening. I think we're having a problem with the video. Can you try, could our technical people help us get the video from Ms. Maimunah Sharif, please?
Yeah, I think if we stop the screen share for just a moment and then open the video. And then share from there. When you hit screen share, make sure on the bottom, there should be an option to optimize for video clip. Make sure you click that as well.
Yes, they are. That is selected.
Okay. Yeah, maybe best to get that video pulled up and then share from there.
Services.
Oh, there we are. Thank you.
At UN Habitat, we understand, colleagues, friends, ladies and gentlemen, it is my pleasure to be joining you today from Nairobi, Kenya, through this video message for the 17th International Conference on Urban Health. Many thanks to the organizing committee for bringing together urban health professionals from across the globe at such a pivotal time. The last 2 years have highlighted how intimately tied the public health and urban and territorial planning goals truly are. Cities have been at the forefront of the battle against COVID-19, facing great challenges, but also rising to the occasion by implementing innovative planning strategies to encourage enhanced resiliency, social distancing, and fast economic recoveries. We have seen how related the challenges of the pandemic and the barriers to healthy urbanisms are. Unregulated urban growth led to overcrowding and worsened the spread of COVID-19 in many urban areas, while patterns of sprawl have resulted in decreased access to essential health services. At UN Habitat, we understand that eco-social health needs are the guiding force for sustainable urban development, and cities have a crucial role to play in achieving global health goals. Last year, we published the source book for integrating health in urban and territorial planning, which shows how urban and territorial planning can be an enabler for health and the well-being in cities, working to counter both communicable and non-communicable diseases, improve air quality, public spaces, and access to essential services. In the pandemic response, we monitor closely the local COVID-19 impacts and patterns. This makes it possible for local and national leaders to identify hotspots of the virus spread. With this in mind, UN Habitat and CityIQ launched a platform, the COVID-19 Readiness and Response Tracker, that assesses the daily capacities and responses to the pandemic, encompassing 1,700 cities around the world. The platform helps local governments to prepare an adequate response using evidence on the state of cities before, during, and after the pandemic. Moreover, this data analysis correlates strongly with the guidance given in the sourcebook for integrating health in urban and territorial planning. Earlier this year, UN Habitat published a publication on cities and pandemics towards a more just, green, and healthy future, an in-depth report on how cities have been affected by COVID-19. The report invites us to rethink the urban structural inequalities which have been exposed and enhanced by the crisis. Debates on the health dimensions of space, such as urban density, morphology, public space, housing, and urban infrastructure, have been taking the center stage. For example, we found out that overcrowding has emerged as the predominant driver for the spread of pandemic in cities. However, we also discovered that high density in a context of well-planned proximity was a key factor to ensure better response, coordination, and equitable access to public services. The current global health crisis has transformed into a severe socio-economic crisis. The pandemic has exacerbated the multiple deprivations already experienced by the urban poor communities. Another example of inequalities highlighted by the pandemic is the growing digital divide between urban spaces, communities, and different types of employment. At the same time, the COVID-19 measures put in place by authorities have shown that governments are capable of rapid transformation. This is why this year's theme of transforming our collective urban future, learning from COVID-19, is so important. This conference is an opportunity to better understand the challenges that health and urban planning professionals face in achieving shared goals by an interdisciplinary action. UN Habitat is committed to this collaboration as a facilitator and convener between stakeholders by providing technical assistance and helping with capacity building across urban-rural continuum. It is our goal to improve urban resilience and well-being while focusing on the most vulnerable population within cities, ensuring that we leave no one and no place behind. We must work in line with the prescriptions issued by the World Health Organization Manifesto for a healthy, just, and green recovery to plan better connected, more socially inclusive and resilient spaces to promote healthy and sustainable food systems and invest in healthier environments. Let us raise our ambition to have more cleaner, greener, safer, healthier, and happier cities. I wish you a fruitful conference, and we look forward to reading the outcomes of your deliberations over the next few days. Thank you.
A very warm thanks to both Dr. Carissa Etienne and Ms. Maimunah Sharif. I think we've had some very good inspiration for our work during the next few days. We'll now go to, we have the privilege of having Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, who also sent a message to us. And we'll pass on to immediately after I read a few things about Dr. Tedros. He was elected DG of the WHO in 2017. It was a direct election from all of the WHO member states. And Dr. Tedros was born in the Eritrean city of Asmara. He's a graduate of the University of Asmara with bachelor's in biology. And before he had a Master of Science in Immunology and Infectious Diseases at the University of London. and a PhD in community health and at the University of Nottingham, as well as an honorary fellowship at the London School of Hygiene and Tropical Medicine. Following his studies, he returned to Ethiopia to support delivery of health services, first working as a field-level malariologist before heading a regional health service and later serving as Ethiopia's federal government over a decade as Minister of Health and as a Minister of Foreign Affairs. Between 2005 and 2012, he led a comprehensive reform of the country's health system, built on the foundation of universal health coverage and provision of service to all people. Under his leadership, he developed the innovative health financing mechanism and extended in a major way the health workforce, where he led the development of primary health care extension program that deployed 40,000 female health workers throughout the country. A significant result was the 60% reduction in child and maternal mortality after that intervention, comparing to year 2000 levels. As Foreign Affairs Minister, he elevated health as a political issue at national and global level, and has led efforts at the Addis Ababa Action Agenda on the Sustainable Development Goals. Prior to his election, he led many leadership positions in global health, including chair of the Global Fund to fight AIDS, tuberculosis, and malaria, chair of the Röbbel Malaria Partnership, and of the Partnership for Maternal, Newborn, and Child Health. After taking office at the WHO, Dr. Tedros initiated the most significant transformation of the organization's history, which has generated a wide range of achievements. I thank WHO and Dr. Tedros for this video, and we pass over to the video now. Thank you.
Your Excellencies, Honorable Mayors, esteemed guests, dear colleagues, and friends. The COVID-19 pandemic is a stark reminder of the important role of urban environments in health. WHO is proud to support programs at the local, national, and regional level in their efforts to create urban environments that are healthy, safe, clean, and pleasant places to live. WHO's commitment to urban health is stronger than ever. WHO provides technical support for the pandemic response, as well as guidance around key policies affecting urban health, including transportation, green spaces, and urban planning. We are also working to facilitate the exchange of best practices to strengthen urban capacities and governance for health and well-being. This conference is an important opportunity to share your lessons and experiences with each other, and will also enable WHO to further refine and improve the support we provide. In a few minutes, my colleagues will speak about WHO's expanded vision for urban health. We invite mayors, local and national authorities, scientists, and other urban leaders to work with us to create healthier and more resilient societies. I wish you a productive meeting. I thank you.
Big thank you to Dr. Tedros for being with us in a video and for proposing an expanded vision of urban health. So that gives me great pleasure to introduce Nathalie Röbbel. She's the unit head for urban health at the World Health Organization. Nathalie Röbbel is the lead of WHO's work on urban health at the WHO in the Department of Social Determinants of Health. Prior to this, she was leading WHO's work on air pollution and housing in the Department of Environment, Climate Change, and Health. One of her main areas of work was the development of WHO housing and health guidelines and WHO's effort to address slum upgrading through housing policies and other social policies and interventions. Before joining WHO headquarters, Nathalie has worked as a technical officer for the WHO Regional Office for Europe in Bonn and Copenhagen, where she was responsible for environmental health performance reviews and involved in several urban health-related projects. Ms. Röbbel rose a PhD from the Reinecke Friedrich Wilhelm University in Bonn, Germany. And I try my German, right? Nathalie, over to you.
Thank you very much, Carlos, and thanks also for speaking German in this international conference. Thank you very much for giving us the floor and the opportunity to add a little bit to what Dr. Tedros started explaining about, WHO's vision on urban health. And if you allow, we'll just share my screen to share a couple of slides. Please just give me a second. Can you see my screen, Carlos and colleagues?
Yes, it's fine.
Perfect. Thank you very much. So Dr. Tedros really emphasized the long-standing interest that WHO has given to cities and their role for global health. And indeed, WHO's work on urban health is long-standing. And over the years, you can see on this slide, just a little amount of numerous guidance documents and knowledge goods that have been produced really to support and increase dialogue between health and key sectors. And also, actually, many of the partners that are present today in the virtual room that we are in have been actually contributing to the development of all these materials. But certainly, along with these technical tools, WHO has steadily aimed at prioritizing and supporting urban governance and leadership for health and well-being. And I would say the Healthy Cities, it's certainly one of the flagship initiatives that has been having a high impact, but also in current years, and Dr. Etienne, you have mentioned this in your opening remarks, increased efforts are being done in the regions, and I would say in PAHO in particular, to strengthen urban governance for health and well-being, really with the objective of increasing participatory and multi-sectoral urban governance. And certainly over the years, in addition, we have also seen a growing number of partnership initiatives focusing on key priorities such as aging or non-communicable diseases and injury prevention, but also initiatives aiming, for example, at air pollution reduction and climate change mitigation. And obviously, as highlighted by colleagues previously, in the most recent years, WHO has also scaled up the response on COVID at the local level, really with the understanding that the role of cities in the response on one hand, but also in building back better is of crucial importance. So all this is really to say that, as we have seen, while WHO has been putting quite a lot of emphasis on urban health and has been seeing this as an integral part of the technical delivery mechanisms, and the regions have been playing a major role in this. I would like just to pause a little bit and to highlight the role that urban health is playing within WHO's current and overall programmatic approach. And you have heard DG highlighting that WHO's commitment to urban health is actually stronger than ever. And if you have a close look at the current program of work, so it's WHO's, current programmatic approach, you will see that this program of work really focuses on a triple billion target that aims at achieving measurable impacts. And so by 2023, the target is to have 1 billion more people benefiting from universal health coverage, 1 billion better protected from health emergencies, and 1 billion enjoying better health and well-being. Now, if you look a little bit closer, within this programmatic framework, urbanization has been clearly identified as a key priority and a key determinant of health. And the strategy aiming to support the achievement of the healthier population billion is clearly stating the need for WHO to address the impacts of urbanization. So having this in mind, in operational terms, in a cross-cutting initiative has been established really to help the achievement of not only $1.3 billion on the healthier population, but really aiming at benefiting or helping the population-wide achievement of universal health coverage and protection from emergency through action at the local scale. So all this just in conclusion to really emphasize the strong pre-programmatic recognition that WHO has within its current program of work of the urban health agenda. And I would say that this is resulting in a number of key principles or key priorities for the organization that I would like to share with you. And there are 6 that I would like to highlight. The first is that one of the consequences of this programmatic, strengthening of urban health is that a decision was taken to create a cross-cutting urban health function as part of the social determinants of health team and of the agenda and headquarters to really further support and align WHO's efforts on urban health. So it is about building on all the work that is currently being implemented by the different teams in really to provide support to align WHO's efforts to identify synergies and also to identify opportunities for joint action across the variety of topics. And certainly also to support and increase global advocacy by WHO on urban health. So also to be serving somehow as an entry point for member states, local government, national government, partners that are interested in collaborating with us on urban health. So really to be like an entry point for the organization. The second, I would say, is priority or principle is the overall recognition that there is a need to promote further a systems approach to urban health within the organization, really with the understanding of the structure of the systemic relationship and the positive and also negative feedbacks that really have an impact on system trajectory. So what I'm saying here is that there needs to be an effort to merge programmatic efforts across the house and building on the different approaches, the successes and experiences taken by the organization, really having in mind the understanding of the centrality of health in development at the very local level. And if we move to the third, this means that based on the example and experiences, for example, of PAHO, and we have mentioned, Dr. Etienne mentioned in her opening the action plan and the regional strategy on urban health, which has been, a key example, a key achievement on the urban health work. There's a question whether this is something that could be taken up at the global level, taking into consideration that we have a huge amount of really important entry points to urban health through the health promotion agenda, through the social determinants of health agenda and the environmental. But maybe time has come, and I'm putting this with a question mark, to bring this together in a global urban health strategy, following the experience of our PAHO colleagues. Moving to the next one, I think that nothing can work without key partners, and WHO has a long-standing tradition in working closely with many of the partners involved in this conference, but also in the participants. But I think it's important to enhance and amplify the role that these key partners are playing, not only for the technical entry points, but really broadly for the urban health agenda. And obviously, UN Habitat is one of the key partners for WHO, the International Society of Urban Health, a large number of non-governmental organizations and other alliances. And there needs to be a mechanism put in place, not only to have them involved within our different technical areas related to urban, but really in the programmatic approach to developing and further roll out this agenda. Fifth, it's scaling up capacity building. There are many efforts being taken on strengthening capacity building for urban health related issues, being it from a health and all policies perspective, being it through an environmental and health perspective. But I think the moment has come and the request has been made to WHO to be really strengthening a global training approach for sustained capacities for multi-sectorial health and health equity action at urban level. So taking stock of the newly established WHO Academy that is promoting lifelong learning and is reaching out to a variety of partners, really the objective for our work is to be building together with partners a training course for sustained capacities. And we hope to have the opportunity to work with many of the partners involved in this conference. And last but not least is the objective of setting a research agenda on urban health. WHO is really proud to be, working in collaborations with the International Society of Urban Health and many other partners. Carlos, you mentioned this piece of work in your opening. And I think this is really one of the key global goods that we are aiming to deliver by the end of this year, which really aims of bringing together all the knowledge that has been, achieved by our different colleagues within the House, by the expert community and academia, and really being able to come up with a consolidated urban health research agenda for the future to come and for helping implementation. And with this, I would like to close, just to reiterate WHO's strong commitment to support UN-wide efforts of working more closely at the local level. So in particular with the local 2030 agenda on the SDGs, but other mechanisms. And we are very much looking forward working together towards healthier populations at the urban level. Thank you very much, Carlos.
Thank you, Nathalie. Many thanks, and I'm very happy that to hear of this new initiative and to learn that you're all engaged and across the House in bringing all these pieces together. This is excellent. We'll have now, it also gives me great pleasure to introduce Olga Sarmiento, who is one of the board members of ISUH and is here as the lead of SALURBAL, which is this major network of research and action in urban health in Latin America. Dr. Olga Sarmiento is a professor of public health at the School of Medicine at the Universidad de los Andes and a principal investigator of SALURBAL Project. She's a director of the epidemiology group at the University of Los Andes and a board member of the International Society for Urban Health and part of the Latin American Network on Urban Health. Dr. Sarmiento's current research includes urban health, specifically the evaluation of health behaviors and the environment, with a special focus on community interventions in Latin America. She has an MD from the Universidad Javeriana de Bogotá, a Master of Public Health and a PhD in Epidemiology from the School of Public Health at the University of North Carolina in Chapel Hill. Thank you, Olga, over to you.
Thank you, Carlos, and I'm gonna share my screen. Can you see the slides?
Yes, perfect.
Perfect. Thank you, Carlos. And hello, everybody. And hola a todos, muchos de los que hablan español. So right now, on behalf of the SALURBAL Project, which is Salud Urbana en América Latina, I want also to welcome all of you to this 17th International Conference on Urban Health. I know that for some of you it's very early and for some of you it's very late, but I think for all of us, this conference will be a really an enlightening experience. As Carlos said, we have more than 400 participants representing 59 countries. And I also want to, again, thank our sponsors that are the Bodnar Foundation, Novo Nordisk, and Novartis Foundation. Our conference host is our society of the, which is the International Society on Urban Health. But this year, I want to stress out that we are from Latin America co-hosting this conference, specifically from the Pan American Health Organization and the SALURBAL Project. So I will provide a little bit of context of the SALURBAL Project for many of you that probably are not that familiar. So the SALURBAL Project, Salud Urbana en América Latina, it is an initiative of the Urban Health Network for Latin America and the Caribbean, and it's funded through the Wellcome Trust, Our Planet, Our Health Global Initiative. Our team is made up of 300 researchers and other professionals who are based on these 15 institutions throughout Latin America and also the United States. Drexel University is our leading institution with our principal investigator, Professor Ana Diaz-Ru. And many of these institutions that you see here are academic institutions, but we also partner with a number of public agencies, including the Pan American Health Organization. So we are 15 institutions that are providing unique research results on urban health for the Latin American region. This is the vision of SALURBAL. We want to create evidence base to make Latin American cities and other cities healthier, more equitable, and environmentally sustainable. We also want to engage with policymakers and the public in a new dialogue about urban health and urban sustainability and the implications for societal action. Finally, we are creating a platform and a network that will ensure continued learning and translation. These are the 4 aims of SALURBAL, and during this conference, you will see the results of many of our aims through the different panels, workshops, and all the presentations that we will have from our team. So the first aim is to identify city and neighborhood drivers of health and health inequalities among and within cities. The second aim is to evaluate environmental and equity impact of policies and interventions. The third aim is to employ systems thinking and simulation models to evaluate urban health environmental links and plausible policy impacts. And the fourth aim is to engage the scientific community, the public, and policymakers to disseminate and translate findings. And with all these aims and the results that you will see in this conference, we want to provide lessons from Latin America about what makes cities healthier, equitable, and environmental sustainable. I want to highlight the dissemination and policy engagement throughout the life cycle of SALURBAL. So just to give you a little bit of an idea of SALURBAL, SALURBAL started in 2017, time when we developed literature reviews, policy briefs about urban health in Latin America. Subsequently, we have developed our research questions and aim. We have compiled and created the largest database of individual, social, and built environment indicators for cities and subcities in 11 countries in Latin America. And we have conducted the evaluation of policy interventions in our region. All of this research has been disseminated through blogs, academic papers, webinars, policy briefs, and we want to, through this dissemination, to reach multiple audiences. To date, 4 years after starting the project, we have developed policy relevant research findings, and we have engaged with policymakers and community with a very wide dissemination. And again, as I say previously, during this conference, we will present many of the findings of SALURBAL. I just want to highlight, this is the series that we have of policy briefs, which are lessons from Latin America, a part of our many academic papers. We highlight in these policy briefs key urban health topics, challenges, and recommendations for policy actors. Everything is published in English, Spanish, and Portuguese to reach our wide audience internationally, but also in the region of Latin America. And I also want to highlight our network. So this figure shows the temporal network of SALURBAL members from 2017 until 2020. This network has been characterized from the beginning to be very diverse, but together the cohesion, diversity, and the collaborations among junior and senior researchers within and among countries has grown and is being strengthened through time. So this is what you see. These are the network when we started in 2017. This is what we have on right now. So to date, the SALURBAL network is characterized by being highly cohesive and very diverse by country, by disciplines, by gender, and by seniority, which is fundamental for innovative, applicable, and diverse research. And it's very important for capacity building in the region. Lastly, I want to highlight that this cohesive and diverse network of SALURBAL really emerges from the region of the magic realism. It is certainly an unprecedented network. We are telling the story of urban health research in Latin America. And in this context, I'm going to quote the Nobel Prize Gabriel Garcia Marquez, who once said, "The interpretation of our reality through patterns not our own serves only to make us ever more unknown, ever less free, ever more solitary." He always highlighted the importance of measuring and telling the story of Latin America through the eyes and voices of the Latin American people. This is what we are doing in SALURBAL. Once again, through SALURBAL, we are providing lessons from Latin America about what makes cities healthier, equitable, and environmentally sustainable. So on behalf of SALURBAL Project, I want to welcome you again to this 17th International Conference of Urban Health. I know it will be a unique opportunity to learn from urban health in the world and from the research on all of these diverse networks in the global north and also in the global south. So welcome everybody again to this conference.
Thank you, Olga. Thank you warmly to you and to SALURBAL. I think this conversation that we just have, my feeling is that we have a lot of affection for each other as institutions, as individuals, and that's what makes a network. So I'm very pleased that we are embarking and contributing to this field of urban health from different perspectives. We bring our own gaze, our own perspective, as you very well pointed out from Garcia Marquez. And I'm really pleased that we're able to bring together these different perspectives here in this opening panel. It bodes well for the conference. I'm excited to not only to hear about the developments that you showed are happening, but also to learn much more about this, the SALURBAL comparisons. I mean, it's very impressive to have comparisons across 300 or 400 cities. I think we're all looking forward to learn that. And certainly we're looking forward to establish new connections because the world is very big. There's many experiences and there are many perspectives that come through. So to understand how this field operates, it requires some diligence, some attention, some focused engagement. And that, I think, it's what we're there as a society and as a group of partners. Thank you, Carissa, warmly. Thank you, Olga. Thank you, Nathalie. And thanks to WHO and to UN Habitat for being here with us. So we're over to the next panel, and we're closing this now. We're 3 minutes late, which is not very bad. I thank you all, and the next panel is about equity in Latin America. So we're going to immediately go there. Thank you very much. And safe travels, mind travels to all of us during this conference. Bye.